Well, everybody knows that healthcare in British Columbia is deteriorating at a very fast rate. I would say it's now a snowball. But what we're going to see with the acceptance of the passing of Bill 36 back in November is we're soon going to see that this snowball turns into an avalanche. This will be an avalanche, really, of practitioners of all types: doctors, nurses, chiropractors, naturopaths, pharmacists. Many of our healthcare practitioners will be leaving the province or retiring, because this bill held over their head is certainly a sword which can, I would say, separate them from their patients, but also separate them from their paychecks, and also put them in jail. I'm going to talk to you just briefly about what it's like from a doctor's position, looking at this new Health Professions and Occupations Act. As a doctor, if we do not propagate the narrative of the government, the Ministry of Health, then we will be potentially jailed for up to 2 years and given a fine of up to $500,000. That would be for an incorporated doctor. And you may know that many of the doctors in this province are incorporated. Now, what does it mean to speak the government narrative? Well, if we look over the past 3 years, we'll see that there have been some of us doctors that have been speaking out, trying to follow the science, to present the research which shows that some of the healthcare policies have not been good for the populace of our province. If we look at the future, where doctors don't have that opportunity to speak out to their patients or to individualize their therapy, which means that if a patient is sitting in front of me and I feel that the recommended treatment by the government is not really fitting for them, I will be under threat of a huge fine and possibly imprisonment for telling the patient what I really think is good for them. This will mean that doctors will feel that their hands are tied. The other thing is that a complaint can be made anonymously about a doctor speaking out of line or behaving out of line in some way, and while the investigation is going on, the government can lock the doors of that doctor's office. In other words, without even being proven to be guilty, the doctor's office can't be closed. Also, they can come in and seize patient records without the doctor having anything to do with it. So from a doctor's perspective, there's no reason that you would really want to stay in such a dangerous situation. You would move to another province, you would leave the country, and I have colleagues who have done just that. Furthermore, you may decide to take retirement early. Or if you stay around, you're going to be so stressed that you will get sick and have to take strict sick leave and not be able to practice. So it seems to me that this act, from a doctor's perspective, and I think I like to speak from a healthcare practitioner's perspective, is going to only have a detrimental effect on the future of healthcare in BC. Right. And this act needs to be stopped, either repealed or held up until we can have a fair consultation with all the stakeholders in what it really contains and what it will do. Thank you.